This is Dr. Brandon Erickson from the Rothman Orthopaedic Institute in New York. I'd like to thank our Japanese colleagues for allowing us to present our research, and I'd like to thank my co-authors on this article. Today we're going to talk about the in vivo effects of partial UCL tear location on ulnohumeral joint gapping with stress ultrasound in baseball pitchers. These are my disclosures, which are not particularly relevant to this talk. Now, the reason we're all here in 2023 talking about elbow injuries is because we know that these are common injuries, especially in our baseball players. If you take a look at Chris Camp's study from back in 2018, when he looked at all of the injuries in professional baseball, elbow UCL tears were the sixth most common injury throughout the entirety of baseball players. And if you break down the injury a little bit, you can see here that, of course, the majority of these happen in our pitchers. And if you look at how many had surgery, about 50% of these players ended up having surgery for this. So this results in a significant amount of time lost and, of course, amount of money lost in these professional baseball players. Now, if you look at stress ultrasound, this has been a very nice imaging modality that's provided us with an alternative means of evaluating UCL injuries by dynamically assessing the amount of ulnohumeral joint gapping there is under a valgus stress. But there's been some controversy on prior cadaver studies as far as the tear location and how this kind of affects the amount of joint gapping that exists. Now, Dr. Scotti did a nice study a few years back and gave us a lot of baseline data as they did ultrasounds on 368 asymptomatic baseball pitchers in the preseason and determined mean UCL thickness as well as the amount of joint gapping that we saw. And this kind of prompted us to do our current study, where the purpose of our current study was to look at some in vivo data from patients with MRI-documented partial UCL tears to determine if the anatomic location of the tear, proximal or distal, influenced the amount of stability of the elbow based on ulnohumeral joint gapping on stress ultrasound. And we thought there wouldn't be a difference between tear location and the amount of gapping. So from a methods perspective, we took all patients from a 5-year period who were determined to have a partial or full thickness UCL tear that wound up having a stress ultrasound. And we looked at all the demographic data for these players or patients. And then we looked at their ulnohumeral joint gapping on a stress ultrasound. And we calculated a delta here. And by that I mean we took the amount of stress, we took the amount of gapping at the ulnohumeral joint without a valgus stress and with a valgus stress, and we took the difference and we made that our delta, okay? And then what we wanted to do was compare the amount of gapping between players with partial tears, both proximal versus distal, and then based on level of competition, high school, college, and professional. And then we ran a multivariate regression analysis. And what you can see here is we had 60 male baseball pitchers that we included. 53% of the tears, 53% of the players had proximal tears, and 47% had distal tears. They were pretty evenly split between the two groups. Now, the mean delta value was just over 2 millimeters amongst our pitchers, okay? So the mean amount of gapping between not having a stress and with a stress, a valgus stress placed on the elbow, was just over 2 millimeters. And the majority of these pitchers, 83%, were considered to have abnormal UCL laxity on their stress ultrasound. So having a partial UCL tear didn't mean that all of the pitchers had an increased amount of gapping, but the majority of them did. And when you look at joint gapping and you look at that and you break that down based on level of competition, right? High school, college, and professional, we saw that there was a different amount of joint gapping based on the level of competition. College guys had the most gapping, then high school, then professional players had the least amount of joint gapping. And if you look at the percentage of pitchers that have abnormal UCL laxity, again, college pitchers, essentially all of them had abnormal joint laxity, less in the high school group and even less in the professional group. And this was statistically significant. But when we controlled for age, BMI, level of competition, we did not see that tear location was related to ulnohumeral joint gapping. So having a proximal or a distal tear did not increase your risk of having a significant amount of ulnohumeral joint gapping. You can see here, proximal tear versus distal tear, the delta that we saw was not statistically significantly different, nor were the number of athletes with abnormal delta values. Now, of course, there's limitations. This was certainly a small cohort of patients here. It was a relatively robust cohort for this type of injury and was a lot of stress ultrasound data. So take-home point from this. We did not see a difference in the amount of ulnohumeral joint gapping on stress ultrasound in symptomatic baseball pitchers that had an MRI-documented partial UCL tear based on tear location, okay? Although these differences were not statistically significant in the amount of joint gapping, there was a trend towards a slightly greater proportion of distal injuries resulting in an abnormal stress ultrasound, but this again was not statistically significant, so we have to do some more studies and look at this a little bit closer with a higher amount of patients included. Certainly some further reference for you. Again, I'd like to thank our colleagues, especially Dr. Sagai, who contributed to our elbow book here, and I thank you very much for your attention. Look forward to the discussion.